So here you are watching coblation tonsillectomy in a 6-year-old child. I'm doing it on the left side. I have already got into the correct plane from the superior pole. You can see these small vessels which I am coagulating without exposing the muscle. If there is any small vessel here, I am coagulating. And now that's the correct plane. So for the left side, with a right-handed surgeon, I am pulling the tonsil with a lux forceps. Now you can see a small vessel over there. You can simply touch it. Do not expose any muscle if you want the surgery to be painless and bloodless. And only dissect the connective tissue fibers so that you get a perfect bloodless and painless surgery. Now opening the tonsil like a book, getting into the correct plane, remaining on the lymphoid tissue and just opening up the fibers. Again holding it again, pulling it medially, remaining towards the tonsil. Some amount of exposure of the muscle has happened. I could not avoid it because it's an extracapsular surgery, but try to minimize as far as possible. That is the correct plane. And now we have reached the lower pole. So at the lower pole, we expect the tonsillar arteries to come into the tonsil. So I'm first coagulating along the course of the tonsillar artery and then dissecting at the most medial aspect. So you see that it's a complete tonsillectomy, but first coagulation, let me just focus it a little better. First coagulation of the tonsillar artery, the branches, and then coagulation at the most medial part. I have not gone intracapsular, I have still remained extracapsular. So every bit of lymphoid tissue is out, but still with minimizing the chances of bleeding. Alright, so this is the lingual tonsil. If I see the lingual tonsil a little large over here, I am reducing the lingual tonsil by ablation as well, and the last bit by coagulation. So this is coblation. Hold on. Let me show you the fossa. So practically there is no exposure of the muscles in this part. You can see the fascia very well. There is a very little amount of exposure of the muscle in this part. Obviously the lower end, it's a sharp dissection, so there will be some exposure of the muscles in the lower end. So rest of the surgery is going to be almost painless and bloodless. Thank you for watching.